Hello, guys. Welcome once again to another episode of Surviving COVID-19. Once again, I'm Dr. Shelley Glover. I'm a board certified obstetrician gynecologist who practices gynecology, anti-aging, and wellness in Claremont, Florida, which is basically about 20 minutes outside of Orlando, Florida, which is obviously located in Central Florida. So, I don't even know what count we're on. I think we're on about our fifth or sixth series discussing the COVID-19. And as those that have been watching are aware, basically what I try to do is come on once a week, Fridays at 4, and kind of share what's been going on over the last week that has to do with COVID-19 that maybe needs to be hashed out, and also try to find something else interesting that maybe you haven't heard or haven't seen. And we've had some really great speakers be able to join me. So far, it's been all physicians, so I'm really excited because I'm going to have a non-physician on today who is a COVID-19 survivor. So we're going to get a little bit of a different perspective, but I think that you guys will really like it. I think that you'll be pleased. So, what's been going on in the country? What's our stats, etc. So, let's go over the stats real quick, and then we'll start going a little bit further into some details as people start jumping on. Okay, so worldwide, we are up to 5.17 million cases from like 3.9. So our numbers are really climbing worldwide as far as the number of people infected. The death rate is up to 336,000 from 274,000. Within the United States, we're at 1.62 million people diagnosed with the virus, and 94 0.57 thousand have died. So we're almost, at 100,000 people that have died from this virus so far. The statistics in Florida, 49,451 is our current count of coronavirus positive people, and our death rate is we've had 2,190 people die so far from the virus. That's up from 1,667. We are testing more. We talked about that last week. So the numbers will go up, but the numbers are also going up because there's a lot of people out there that are positive. So don't miss the forest for the trees. Don't say, oh, wow, that's, so it's okay. That's just because they're doing more testing. Well, guess what? If there weren't people that were positive with COVID-19 out there, the test would be negative. So it's not just that, yes, they're doing more testing, but it's also showing you how prevalent the disease is out there. So we're doing, our numbers of positive have gone down because we're doing more testing. So even though we have 49,451 people positive, our percent positive rate has gone down from 8.6% down to 5.9%. So we are getting the test done, and I'm really happy for that. Our numbers are holding at about 20% of the cases are serious, meaning those people are either hospitalized or dying. The death rate in Florida, these are Florida statistics. The death rate in Florida, 4.4%. Now, so what's interesting is that our percent testing positive number was the highest earlier this week. But our death rate per day is actually the lowest that it's been in Florida. So that's really good news, especially in the face of reopening. However, we know that the virus takes about 5 to 7 days to manifest and can take up to 2 weeks to manifest symptoms. So we're still going to just start to be seeing the effects of reopening from basically May 8th now, and then the effects from the last, like this week where we're at 50% reopen, we're going to see those effects more so in the next 2 weeks. So it doesn't mean that we're out of the woods. We're going to see as the data starts to unfold how all that's going to how the reopening is really impacting us on the severity level. The amount of people that are testing positive, we're kind of equal, men and women. And as far as the data period, just so you know, there has been some concern that the Florida data is not accurate. I can tell you, and so there are people out there saying, oh, okay, it's skewed to the negative, where they're saying that people are dying of COVID-19 that aren't, and then you've got people that are going the other way and saying that the data is underreporting, and it appears that if anything, it's actually more of an underreporting, and the discrepancy between the data that's with the Department of Health versus, say, with the medical examiners. The medical examiners will look at and go back and find out what the actual cause of death is, and that's a whole conversation that we can have at a later time, as far as how people are classified as what actually is the cause of death. But they're going to also do residents versus non-residents, and the DOH is basically doing residents. They do the non-residents, but everything is broken up separately. So the percentages and stuff are usually done based on the residents of Florida. So that means that if somebody came here from Connecticut or from New York and then they die, they'll be classified in the non-resident percentages. So that can explain some of the data. I can tell you that the COVID-19 Florida database is definitely not what it was. It is definitely much harder to get the data out of there. So when I sit there and I try to get it so that I can give it to you, it's like pulling teeth from a baby. Whereas it was definitely much easier to get the data a couple of weeks ago. But hi, Karen. There is our Orange County numbers real quick. We're at 1689 cases. We were at 1478 previously. The amount of hospitalized people is about 300. Now remember, that's going to be a yin and a yang. That doesn't mean that the same 300 people that were in the hospital last week are the same people that are in the hospital this week, but at least the numbers haven't gone up in the hospital. The death rate has gone up from 35 to 38, but they definitely are doing their darndest to keep our patients alive. Lake County's numbers have gone from 237 to 254. There are more hospitalized, from 59 to 68. And the death rate went up by 1. So we've had 15 deaths in Lake County from 14 previously. As you guys know, we went to 50% reopen on Monday within restaurants. The recommendation is still for the physical distancing of 6 feet. The Disney Springs opened up on May 20th. Universal's already open. City Walk. And there's a thought that the parks are starting to look at potential reopens in June, and so they're trying to get some approval on that. Latest thing from the governor earlier today was that youth activities could be reinstituted. And so still melding through that, but his thought process, from what I could see from the conference, was that his video conference was that they haven't seen the deaths in the younger people, so therefore that they wanted to kind of and that the young people have been quarantined for extensive periods of time, so they wanted to start getting them back out and allowing the kids to resume some athletic activity. Having said that, even though we're not seeing the deaths in the young ones, you may have heard about this autoimmune syndrome that seems to be an inflammatory disease that is occurring in children. So it is not that our kids are completely out of the woods. They may not be dying of COVID-19, but there is a very serious immune disorder that is affecting kids. They're seeing it primarily in the states that have been really heavily ravaged, like in New York. And it seems to be occurring a little bit later. So it's not like in the height. It's not like something that the kids are getting right away. It's something that's occurring, it seems like a month or so out. And they're having this issue where they're having a total body inflammatory syndrome, similar to something called Kawasaki's disease. So just be aware of that. And if you notice that your child was actually showing some very serious symptoms of being ill, take it seriously, and once again get your child to the hospital. And don't, as we've said over and over again, the hospitals, at least in Central Florida, are prepared to handle the COVID-19 and are prepared to handle regular emergencies. So please make sure that if you are sick and you would normally have gone to the hospital because you're having chest pain or you're having something serious that's affecting you, that you do go to the hospital. You certainly do not want to be so afraid of contracting COVID-19 that you stay home and run the risk of dying of something else that could have been prevented if you had gone to the emergency room to get care. The physician's offices here in Central Florida, the majority of them are opening up if they were closed. As I've said before, the majority of us are also offering telehealth. And if not, if you can't reach your regular primary care physician or your rheumatologist or whoever it is, then I'm sure that if you reach out to one of your other doctors that you can get care. So there's no reason that you should run out of medications or anything like that. I thought that we had already addressed mask until I was blue in the face, but it still seems like there is some controversy about it. And I think that we just need to really be clear that masks are recommended, and that you should really wear them. That the number one way, we've said over and over again, that it appears that this disease is transmitted is from this area. So primarily nose and mouth, but including it maybe eye, we don't know. So we certainly, if you're around somebody that's coughing and particles in the air, then yes, if you wear glasses, that's a good thing. I'm not saying that you have to go out and get protective goggles and walk around with those. And the CDC is now publishing some data recently that's saying that it appears that even though there may be COVID-19 on surfaces, as they've said, that can last maybe for several hours or several days, it doesn't appear that is where that it's actually accounting for any significant amount of the contagion. The contagion still seems to be with the respiratory transmission. That does not mean that you should just kind of let go and say, okay, forget it, I can do whatever I want. I mean, I'm still the wipe down Nazi, but excuse me, I shouldn't say Nazi, excuse me, but I make sure my hands are super clean and that everything is wiped down, and my staff will tell you that. But they have said that it doesn't appear that the transmission is extremely high from that mode. So be aware of that. But I still recommend being safe. But that takes us back to the fact that I don't recommend that you wear gloves. So still good hand washing, wash hands, wash hands, wash hands. They've done study after study, and even besides this particular illness, any illness where people wash their hands more repetitively, there's a decrease in those people contracting it, because we just touch our face way more than we think we do. So the cleaner your hands, the less likely, even if you're touching infected surfaces or you're touching other people, that virus is then going to get up into your face area. Remember, we want to wear our mask and we want to keep our hands off of our face. So that's the whole point of wearing the mask. Let's see, I think I'm kind of covering most of what I was planning to bring up, unless you guys, there's a question about, the test. Kathy Gavin Kelly is asking about why it takes so long for the test results to come back. Yes, it does. The time can be anywhere from 2 to 3 days within the hospital to 7-8 days outside of the hospital. And I'm not saying all of it. Really, really, really is very independent on where you go. And I'm sorry, I can't tell you where the fastest place is. That's what I did want to go over real quick again, because I looked at my own video from last week and I kind of confused myself. So remember, there's 2 different tests out there as far as there's tons of tests. There's a nasal swab and there's a oral swab and there's a saliva and all of that. But there's antigen testing and there's antibody testing. So just really quickly, just in case I confused anybody last week, or if you've heard things that are confusing you this week, the antigen testing, which is primarily the swab testing, is looking to say, do you have COVID-19 now? Do you have it and not know you have it? Or if I'm symptomatic, do you have it and that's why you're symptomatic? Because remember, there's a lot of people out there. We just said there's almost, well, yeah, 90% of people out there with COVID-19 are not having any symptoms, or not ill, or are not significantly ill. So do you actually have it right now? Okay. Then the antibody test is saying, have you had it? So, and then you actually kind of almost need both of them in the middle to be base. You need both tests to really get the full data. So, for example, I told you that my whole staff got tested last week. Well, we did the antibody testing, and because it was rapidly available at that moment, and so I said, okay, let's do it. And so we did that, and we all came back negative. Great, right? Well, okay. What does that mean? It means we didn't have COVID-19. We never got it. Well, I didn't really think we had. None of us had been, well, my nurse practitioner had been very ill about a month or two ago, but the rest of us hadn't been that ill, so I really didn't think necessarily that we'd had it anyway. So that wasn't necessarily, in retrospect, as good as if we had actually brought in the whole office and done the COVID swab testing. So guess what? We're going to be doing COVID swab testing next to say, do we have it now? And then for those people that test positive, and our guest will tell you that that's not always accurate either, but if you do test positive for the COVID-19, then what they do is they follow you out, because people say, well, what happens now? I'm COVID-19 positive. I'm not having any symptoms. What am I supposed to do? The recommendation is that, once again, even if you're feeling okay, you could be transmitting that to other people, including in your home. So once you've tested positive, you really need to practice quarantining yourself, meaning you want to kind of keep your distance from everybody. You want to be careful with going to the bathroom, with how you're eating. Don't share meals with other people in your family. It's good habit just not to do that, period, anyway. Your mama told you that a long time ago, and not to eat after other people and drink after other people. So it's actually a good thing. And mom was right. And so these are basic things that we want to do anyway. And so you should start doing that whether or not you're COVID-19 positive or not. But then you do the COVID-19 test. You're positive. Okay, I'm positive. So I quarantined myself for 2 weeks. Now what do I do? Well, assuming you're nice and healthy and had to seek health care, that's a big, big plus. Okay, now you want to re-swab again and see whether or not you're still positive. And what they do is they follow you out until you actually had 2 negative swabs if you're ill. But that's how you would actually know. You want to be actually negative. Then if you paid attention to Dr. Joseph, who was on the call last week, she said that what was happening is people were doing the antibody testing to see if they were quote unquote done, and they were doing it a little too soon, and so they were still coming up negative because their body, the whole point of the antibody testing is that your body has formed an immune response to the virus. You have to give it a chance to do that. And so she said that the recommendation has been to push that test back and actually wait more till you've been disease-free for about a month before you actually do the antibody testing. But of course, we all want to kind of get that answer real quick because we want to know, and we want to be healthy, and we want to be done with it, right? So positive antigen, I've got the disease right now. Positive antigen, negative antibody, I have the disease right now. Positive antigen, positive antibody, I had the disease. I'm on my way to recovery, but I'm still infectious because I'm still releasing virus because I'm still positive on my swab, but I'm also forming antibodies. So I'm on my way to being cured, but I'm not 100% cured. I'm probably okay, but I can still be infecting other people. So what we want in the big scheme of things, as we go forward past this and we're getting further down the line, is the goal is to be antibody positive, meaning I've had the disease and I'm over it, and swab negative, meaning I am not active with the disease right now. So that's the goal, is negative swab, positive antibody. But if you had to choose between the two tests right now, unless you had a severe disease previously in the last, since this all kind of broke out sometime in January on time frame. And yes, I know that there have probably been cases before that, but those are few and far between. So unless you know that you were in a high-risk situation, exposed to someone who definitely had COVID-19, or were severely ill yourself, I would recommend doing the screening first versus jumping to the antibody because, like I said, once you do the antibody and it comes back, the only time it's going to be helpful is if it actually came back positive. And even if it does come back positive, you still have to go back and do the swab to say that you're positive and that you're still not infecting someone else. So that's my recommendation for all it's worth is if you get to choose between the two tests, that you do the swab first, antibody second versus the other way around. Just my personal recommendation. So without further ado, I'm going to, and so I'm sorry, back to your question, Kathy, if someone actually is either concerned that they got exposed to COVID-19 or if they are having symptoms, then while you're waiting for the results to come back, you should quarantine. It's not like you wait for this result to say, okay, yeah, you're positive. If you think you're positive, if you're exhibiting any of the signs and symptoms, and it's not going to be, unfortunately, this disease, as we said before, it doesn't follow a checklist. It's not like everybody gets the same symptoms. They don't. So you have to kind of do your own sleuthing. You have to kind of think, have I ever felt this way before? Does this feel like the flu? Does this feel like a regular cold? Or is this something different? I mean, if you get pneumonia, as far as I'm concerned, you're COVID until proven otherwise. I mean, this is we're in May. Most people aren't walking around getting pneumonia in May. So if you're getting pneumonia in May, the likelihood, and we're in the middle of a COVID epidemic where one of the main identifying factors is pneumonia, I think that you probably need to think once again COVID first, second, third, and fourth, and then come back and if it all comes back negative. So do take care of yourself. Remember the swab testing. None of the testing is in place of going and getting care. If you're having shortness of breath, if you're having any symptoms that are very alarming, take yourself to the hospital. The other thing I wanted to just brush on is that I have not gone into, as you know, different preventative protocols, etc., because I get a little wary of advising people that I'm not talking one-on-one with because I don't know what other underlying medical problems you have. And when I'm talking to you about supplements, like you can go buy stuff over the counter and a lot of that stuff is garbage, and so you don't hurt yourself most of the time. But as most of my clients know, we have about 14 different supplement lines, and our stuff is not child's play. So when I put you on something, it's going to be effective. And just like you can have a positive effect, depending on what's going on with you, you could also potentially have a side effect from those. So that's why you don't hear me kind of giving you protocols, etc. However, if you know that you're COVID-19 positive, or if you are exhibiting symptoms of, I don't care, if you're feeling sick, then please contact the office. We do have protocols. We have protocols that I can certainly go over with you to boost your immune system. If you're a frontline worker, call me. Let's talk about it. Let's boost you up. You are at higher risk. Let's get you taken care of. If you're COVID-19 positive, let's get you on some of the protocols and let's start working to keep you out of the hospital. So don't think that, don't quarantine at home when we can be being proactive and trying to get you to be as healthy as you possibly can. The office, once again, is open. We're available on a regular basis by phone. Please be patient with us. Just like a lot of the other small businesses, we did have to cut staff down during the majority of the epidemic. We're still not at full staff. We're coming back full staff. We'll be at full staff and full operation on June 1st, God willing. But so if the phone rings and please hang up, call back. We have the patient portal. That is wonderful. Use it. We will get back to you. Yes, you can send us an email. You can go through Body Balance and send us emails or concerns. Our gynecology specialty care website is under construction, so you're not going to get far with that. But try to be gentle with our staff because they're doing the best they can, and as we all are during this pandemic. But we're excited to be open. We're excited to be able to take care of our clients. And like I said, the telehealth is taking off, and our clients love it. And as I told you before, if you love it, make sure you tell your insurance company you love it so that after all this crisis goes past, you can still get your telehealth visits paid for. So without further ado, I want to introduce our guest. And this is, hold on, let me get her up real quick. Uh, it's Krista Brock, and she is a artist, and she's a COVID-19 survivor. She's also a world history teacher. And if I'm butchering it, you can tell me. And she says her greatest accomplishment is being a wonderful mom and wife. And she lives in Claremont. She's a native Southern California girl, and I don't think she knows, but I actually did my medical school at UC San Francisco, and I trained in LA. I got my master's at Berkeley and in maternal and child health, and then I kind of went around the Bay, and then went down to LA. So I've kind of been all around California except for San Diego. And I've been here since 2000, and you've been here since what, 2002?
2001.
2001. So we kind of arrived here. So we're both transplants into Central Florida for about the same time.
Yeah.
So Krista actually became ill about March 24th and has had a very harrowing experience, very sobering experience. And she agreed to come on and talk to us about it because it wasn't what you're hearing when you hear about the typical fevers and fatigue and cough. And so, and also, so she's going to talk to you about that and just her own personal experience. And feel free to put your questions in the chat, and we will try to answer as many as possible. But for now, I'm going to turn it over to her and let her kind of tell you a little bit more about herself and about her experience.
Thank you. Thank you for having me. I think that my story is important here because it is incredibly unusual. Can you hear me?
Yes.
I want to make sure that I took the mute off.
Yes.
Since we were playing around with that. It's unusual because I am a 47-year-old, almost 48-year-old, very healthy person. I had only suffered from allergies, probably like every single person here in Florida, especially as a transplant. You tend to realize that you're allergic to Florida, basically. And so really those were my only true struggles. I had a little bit of pain from painting and bending down. And I say that for a particular reason because later on, as the COVID progressed, I began to blame certain things that I was feeling on neck pain. So I think that's important to note. Aside from that, I think that my story is very important to hear because it did not follow a typical COVID timeline. I lost my sense of smell 2 weeks in, not at the beginning, which at first they were stating that was when you would lose your sense of smell. So I'll just start from the beginning. It began almost a month ago. It began on March 24th. And I was just getting ready to start distance learning and was getting ready to get on a Zoom with some of my kids and noticed that I was a little bit out of breath. Later on that night, I kind of ignored it because, you know, who knows, you know, it could have been allergies. It could have been this. Maybe I had done too much prior to getting on that phone call. You can always excuse things. That night, I was walking around the block like we always do with my husband and my dog, and he was kind of like outpacing me, which I'm a fast walker. He does not outpace me. So I started to feel very out of breath and thought that was strange, kind of said, maybe I need to start working out more. It was weird, you know, and I think that at this time, nobody wants to go to the thought that you have COVID. First of all, I had no fever. I was not coughing. I did not feel congested in any way. So why would I go there? On the 25th, I definitely was out of breath. I felt like I could not walk and talk at the same time. So I called my doctor, Dr. Benet. She's through Care Here, which is an awesome place, through Lake County Schools, and started telling her about it. And she immediately, this was on the 26th. My memory's a little shot from what happened later on in the story. But on the 26th, when I was talking to her, I was walking my dog out front and could not hold a conversation with her. She immediately wanted me to go for a CAT scan. Went for a CAT scan. She hooked me up within an hour. I was there. When they were doing the CAT scan, you're kind of laying there and you're always wondering, like, did they see something? Did they know something? The technician was acting a little strange, asked me if my nails were always kind of blue. I was like, well, it's a little bit cold in here. I don't know. I don't look at my nails that often. Mm-hmm. Kind of knew something was a little up for her to ask that. Within an hour of me being home, Dr. Bennett had called and said, I need you to get to the ER immediately. You have bilateral pneumonia with ground glass opacities. Now, I had no clue what that was other than I had heard it a couple times mentioned on the news. I was shocked as I did not have a cough. I did not really feel sick. I was a little short of breath. When I got to the ER, they immediately tested me for every virus out there. So I went through the 2 different swabs. I had the swab for like the flu and all the other viruses out there. And then they gave me the nasal swab, which honestly feels like they are biopsying a piece of your brain. It's awful. And the technician was terrified. This had been her first time doing it, she told me. So I don't know if it was initially human error when she gave it, or was I tested too soon? Because that can happen as well at the very beginning. I did not cough after I was tested. So I went home. They told me to isolate as though I have COVID. Even though we didn't know at the time, having bilateral pneumonia is definitely a surefire sign at that time. Went into my room. Luckily in my house, we could isolate me. I had a bathroom in there. From that point forward, for 14 days, I had no contact with my family at all. A couple questions that everyone asks is, where did you get it? Do you know who you came into contact with? Did anybody else get sick around you? Mm-hmm. Absolutely not. Nobody got sick around me. I was not in contact with anyone that I'm aware of. I have one vision of the last time I was in Target, and there was an elderly man in there that was basically just hanging out. And he had said that several times to the girl that I was asking questions to. He did not appear very well. I eliminated my shopping trip that day and got out of there and told my husband I was not going back into a store. It just didn't feel good. Now, I don't know if that's where I got it from. We could guess a million different things, but nobody around me got it. And I was never in direct contact with someone that I know had it. Went home, isolated. The only thing that I was dealing with in my room was heavy chest, little bit of the shortness of breath, not much. I kind of had a little bit of a pathetic cough, I called it. I mean, it was like, like you get from allergies. So I think it was 3 days later, I got a call that I was negative. Very surprised by it. Kind of frustrated by it because, you're sitting there thinking you want to know, like, is this it? I was told that 30% of the tests at that point were coming back with false negatives and that I needed to continue to isolate as though I had it. And I did that. Did not come out, no contact with anybody. I would say in the middle of that first week, I got one fever. It was 102. After that, I had never had a fever again. I had a couple low-grade fevers that most people would just dismiss, and nothing else. My cough never got bad. It remained just kind of like an allergy kind of cough. I had no headaches at that time at all. The breathing definitely started to become a little tighter. Within the second week of isolation, I was put on 5 days of prednisone, just kind of commonplace because it was kind of kicking up a little bit with the breathing. After that, I was supposed to be able to come out of isolation. So no fever. My symptoms were appearing to be, for the most part, better. I still had tightness of the chest, but I was told that pneumonia could take up to 6 months to go away fully until I felt completely fine. On the day before that I was supposed to come out of that first round of isolation, I woke up and I had no sense of smell. Very unusual because that's supposed to happen kind of at the beginning. No sense of smell, and I woke up with a corset type of feeling around my diaphragm that was different. So anytime that you had something even slightly different, you were supposed to call the doctor or head right back to the ER. This would now be my third trip back to the ER, because 2 days after I was first tested, I had a little bit of a tighter feeling in my chest. They wanted to have me back in there again. So another x-ray. I had already been there second time. This time, after losing my sense of smell, no, you cannot come out. You have to go back to the ER. Not where I wanted to be. They don't want you there either at this point, because they don't want people coming and going, but I had no choice. Went back there, had another x-ray, pneumonia was still in there, put me on another round of antibiotics, which was very hard for me because I'm not a real big antibiotic taker, but at this point you do what you have to do. It also went against everything that I know about viral pneumonia, which it cannot be treated with antibiotics, but the medical field is doing the best they can at this point. They don't know enough about this, especially then, to know how exactly to treat. They're going to treat what they know, might work at that time. And they all admitted that, So I went back in, I had another 2 weeks. So I isolated for another 14 days. No contact, except for basically with a mask, running through my house while no one was near me to go sit out in the sun, because that was what I had heard, more vitamin D, that might help. Right. I was doing whatever I could at that point. So second round of isolation, and still no big fevers. Little bit of a headache, which I was warned prednisone can do that to you. Mm-hmm. Also, I had been sleeping propped up. And so therefore I thought maybe my neck was getting kind of kinked. I had been doing yoga the whole time in my room, anything to keep me kind of healthy. Ended up getting put through to a pulmonologist who I did a few teleconferences with. And at this point, he believed that I needed to be on more prednisone. He felt that the 5 days was not enough to deal with this type of pneumonia. So I went on a larger course at a high dose of prednisone. I was warned I would have headaches, I wouldn't feel very good, all of these types of things. And that I would probably feel like, hard to breathe still. That was going to take a long time to go away. For the most part, I was feeling okay. Mm-hmm. I was starting to feel a lot better. He wanted me after this second round of isolation, when I was going to be coming out because things were looking better, I needed to have another CAT scan just to make sure. They would not give me a CAT scan until we could make sure that I was not positive for COVID, which I completely understood. But so my husband and I drove to Mall of Millennia, and this time we did a spit in the cup kind of thing. Much easier than the first round. We ended up getting pretty quick results back from that. And it said, again, I'm negative. It also said he was negative, which I was amazed by. Like, as much as we isolated, it's just still kind of a blow mind. Right. And so I was able to go in there and get another CAT scan. What they verified at that time was it was still present in my left lobe, just a little bit, nothing major. The right looked a lot better. And that at this point, after having a teleconference with my pulmonologist, he felt very confident that we're going to wrap up this prednisone. I'm going to drop down the dose. I'm going to take it for the next 3 days. That was like on a Friday, Friday the 24th, I think it was. And by Monday, I should feel like I can start to come out of this isolation, stay off the meds for that whole week, get some better sleep. I had told him that I had been having, and I had by this point had 2 pretty severe headaches. I had told him that the headaches were bad. Now, as a woman and as somebody who prides herself in high pain tolerance and all of these things, I had expressed, and I have tons of friends who are nurses and nurse practitioners, and they had been like my team while I was isolating. Like anything that I needed, I was very lucky to be able to rely on them. I would express to my husband or anyone around me that this headache is like, oh, I can't handle it. It's horrible. At one point, it feels like a baseball bat's hitting me in the head. Now, with that said, people describe their headaches like that. Oftentimes, I've heard friends who suffer from migraines, and I had not been somebody who had really suffered from migraines. I thought I had had maybe a couple, but that's how they describe their migraine. I was also dealing with some neck stuff. Neck stuff can kind of give you some really bad headaches. I had been sleeping weird. I had not been sleeping enough. I had been on prednisone. The stress of having COVID and being trapped in your room for 28 days.
Yeah.
I was about to get my period. Oh, maybe you're having hormonal headaches all of a sudden. There was every single explanation for these headaches. The night before, it was the 25th, almost a month after.
A month afterwards.
A month after I had been diagnosed with what was very common pneumonia. And I was accepting of that, with allergies and all that, maybe my lungs were susceptible. Maybe not. So the night before, my husband said, "Do you want to go to the ER?" And, honestly, no, I didn't want to go to the ER. It would have been like my fourth time at the ER. And at that point, what were they going to do for me? Chances are, they were going to say, "You're probably having a migraine." Or, maybe we would have all made all kinds of excuses. Maybe they wouldn't have. I don't know. Looking back in retrospect, you sit there and say, should I have, or could I have, would it have stopped? I didn't go. I went to sleep, listened to some guided meditation to get me to go to sleep, and it worked. So, there was my answer. It couldn't have been anything that bad if a guided meditation worked. So the next morning was like my big day out. Like, I'm coming out of isolation at this point. Come out, I'm still wearing a mask. I'm being very cautious. My whole family is asleep. I'm going to do a little sweeping because the boys have been dealing with the cleaning. Nothing major. I was being easy on myself. A little sweeping. I made some muffins. I was actually feeling pretty good at this point. I was taking it easy though. And suddenly out walks my husband. And this is a Sunday. He's kind of known to sleep in like a teenager sometimes, kind of thing. And there he is. And I had made some comment like, "Wow, look at you," or something. And he came out and he sat on the couch, which was kind of weird because apparently he was about to go start mowing the yard. I came and walked around to sit on the couch, sat down, and then I felt really tired. And at that point, that's the last thing I remember, because what was just a little COVID pneumonia turned into me having a full stroke in front of him. So that led to a simple seizure that then led to a grand mal seizure. So at that point, I put my head down and said something to him that he could not make out. Did not make any sense to him. He knew immediately something was wrong, called 911. I proceeded to have a seizure. And thank God the EMS got there really, really fast. So between my husband and EMS, they're the first two people that saved my life. They came and started asking questions, and every question they asked, it was my husband's name. It was the only thing that I could answer.
Okay.
Was his name. I don't remember any of this. They wheeled me out, and as strange as this is, I kind of came out of being kind of like having this strange stroke and only being able to answer his name to recognizing my front door was open and I didn't want the cats to get out. And so it was kind of in and out of this weird place. They got me into the ambulance. I remember seeing my son standing at the end of the ambulance and not really knowing who he was really or why he looked so sad, but I knew that I needed to get the words "I love you" out. Something was telling me like I had to figure out how am I going to say those words, and got to South Lake. And luckily they acted extremely fast, recognized obviously that I had had a stroke, and then proceeded to have the grand mal seizure there. Bit through my lip, just what you imagine a grand mal seizure would be all about. And they called a doctor Dr. Rosato at ORMC, who immediately called in TPA, which is an extremely high blood thinner that has to be given within 2 hours. And, or else not a good thing.
Right.
And yeah. And so they rushed me to ORMC, where I was in ICU for 2 days.
So just because we have some people that aren't from Florida, so what Krista's saying is that South Lake Hospital is there are two main hospital systems in Florida. One of them is Orlando Regional, and the other one is Advent Health. And South Lake Hospital is one of the hospitals that is part of Orlando Regional. But then if there's a stroke patient or someone that is critically ill, they will stabilize them at South Lake, but they will move them down to the bigger hospital, which is in Orlando. So that's what she means when she says that she got transferred down to ORMC. That's Orlando Regional Medical Center, downtown Orlando.
Luckily, had an amazing team of doctors. Your regular doctor, the hospitalist who oversaw everything. I had a neurology team and a hematology team. I don't really recall the first 48 hours of being there, which is strange because I was having a conversation with a lot of people. My husband said I retold what happened many times, but I have no recollection of it. And they basically, everybody says, well, how do you know it was COVID? Because you tested negative twice. 2 days after being there, I did get the antibodies test back, but I had it. So, you could say that is why I knew, but at the same time, what they decided to do was both teams split up into two, basically. And they handled my case because they basically called it a medical mystery. They could not understand how somebody who was young, 47, still young, and healthy could have a stroke and several blood clots in their brain that only occurs in 1 in 5 million people.
Right.
So that was just very, very unusual. So what they did was half of the teams divided up and tested me for everything under the sun and treated me and tested me as though COVID did not exist, so that they would not miss anything. They tested me for something called factor V, which is a blood clotting disorder, lupus, you name it. Everything I was tested, blood tests constantly. I had a CT scan every day that I was there, unfortunately, to monitor what the blood clots were doing, see what the stroke had, what kind of effect the stroke had had. I was on very high doses of blood thinners that were, given intravenously at first and then shots into my stomach. And so what they discovered was I had nothing. I had no pre-existing condition. I was in ultimate health. There was they did every vein check that you could possibly find where possible clots had been coming from your legs, your lungs, your heart. Nothing. The venous systems were all working fine. This clot had been brewing, they think, over a couple weeks, maybe the month.
Right.
And it had been created in the brain. And so what it's called is cerebral venous sinus thrombosis. And it occurs way deep in your brain. And so that is what ended up happening. I stayed there in the hospital for a total of 6 days and remarkably have no deficits. Except for a little short-term memory loss. Most people have a hard time talking, walking, doing a lot of things. The only thing that I have that I struggle with is short-term memory. I can't multitask like I used to be able to, and I'm hoping that that'll come back. I have to very much focus on one thing at a time. I often forget if I took Tylenol, so we write it down to make sure that I don't take it again.
Right.
I have headaches still. I have pressure. Like if I bend over, I'll have a lot of pressure in my head. The craziest thing though is to go from when this first came out teaching. And I remember specifically a student, we were looking into COVID at the time, and it was probably around like maybe October, November, because we were researching some of the protests that were happening over in that part of the world. And one of my students had said, "Do you think COVID will come here?" And I said, honestly, like, I don't want you to worry about that. I don't think so. But think about all the different things. We've got the flu, and we have the swine flu, and we have all these things. And I look back to that moment, and it's very surreal that nobody around me has gotten sick, that I was very, very healthy. And here I've gone through something that I almost died from.
Right.
The only thing that they've come up with is COVID, because nothing else registered at all. And to have the antibodies is revealing. No one in my family has tested positive for the antibodies. So it's just, I think it's a story to share because it happened to somebody who's healthy, who had no pre-existing conditions at all, who did not travel internationally, who was not irresponsible when we first started social distancing. That there's really no explanation for it. And so, I think that's why the story needs to be shared. A few things that I think are a good takeaway from my story are, one, if you are having a headache, and I'm not talking about a headache, a normal headache. Mm-hmm. I'm talking about
a baseball bat to the head.
A baseball bat is hitting my head. Okay, go to the ER and have them send you home if it happens. But your pain. Don't be a superstar and act like you have this insane high pain tolerance. Even if you do, it was a headache that now, with having regular headaches now on a regular basis because of what I'm dealing with, there's nothing to compare. My bar is set so incredibly high now for one of these headaches because they were, especially the night before, it was extreme. It was an extreme headache. The weird thing was the next morning I took regular Tylenol tension headache, and it took it away. So again, you don't think that you have blood clots in your brain if regular Tylenol tension headache can get rid of it. So it's a very confusing place to be. You can make all kinds of excuses, but it's always better to be safe than sorry. I don't know if this whole thing could have been prevented. They may have found the blood clots and been able to do something, maybe not.
Right.
But at that point, that was something that, looking back in retrospect, and I don't have regrets, I just think that is something that I want to share with people, that if you're not somebody who normally gets terrible headaches, don't ever question it or think that you're being weak or think that you should have more tolerance for your pain or that it's not something major, because it might be, without setting like fear. Not every headache is a blood clot.
Right.
But I think it's important. That's really, really important. A couple other things, a takeaway for me is with us reopening and everyone trying to figure out, how do you do that? How do you get back out there? I know that it's been a constant talk here in my family because I have a lower immune system now. 7-year-old son who has been very, very good at it and very patient. But when do you know when you start to go back? My thing is this. Open up, go back, but do it with responsibility. Look at wearing a mask as an act of service or an act of kindness, because you might pass somebody like me who had no clue that this could happen to them, and you don't know how you might affect somebody else.
Right.
And it's being responsible. It's looking out for other people that may not know that they are going to be susceptible to it. So I think that is also very important, that I would like to kind of convey. And also these tests. Everyone talks about the tests. They're not 100% accurate. I tested negative twice. Every doctor I talked to in the hospital said the same thing. If you feel sick, call your doctor, even if it's shortness of breath. If you feel sick and you've got all the symptoms, isolate. even if it's 28 days. So that's my story from what I can totally remember. I'm sure
It's
there's
quite
some
a
details
story.
that I left out. Yeah.
I really appreciate you coming on and telling people, because I think that there's several things that we can take from this, and one of them is that if what you said, the test is just a test. There's always going to be false results, and they haven't seen a high false positive, but they have seen that there's a false negative on these tests. Also, that's one of the things I didn't bring up, but if you've been following, you know that there were some faulty tests out there. Almost 2,000 of the tests have since been noted to have been faulty. So I don't have, it's several different testing sites throughout Florida. So what you have to do is just, if you go to, you can actually just Google it. If not, you can go to probably WESH2 has been doing a really good job of following the coronavirus. And so you could go there, and they actually do list the different places. And so if you went to one of those places to get tested, then you need to go back and get tested again, because those tests were faulty. So I don't want you walking around thinking that you are bulletproof, and you're not. So and that's like where some of the controversy is, like, oh, where they're labeling things COVID that aren't COVID because she tested negative. She tested negative, but she had bilateral ground glass pneumonia. It has been documented. Nothing else does that but COVID. So, when you hear that doctors are labeling people with COVID, it's not just, oh, okay, well, we have nothing better to do, let's just label her as COVID. I mean, there are certain things that we do know. There's certain blood values that change in patients that have COVID. There's the CT scan is classic. That's why they did the CT on her as soon as she started complaining of shortness of breath, because they know that what they're looking for now, and they know that if someone comes back with that, who cares what that swab shows? You're going to treat that person. That person has COVID. And so the other thing that we talked about several episodes ago is that there's a hypercoagulable state here. So meaning that the blood is acting, it's clotting differently than normal blood. So that's what she's telling you is what happened. It's they're noticing that people, so there are people that never even get the pneumonia. There's people that don't get the cough, don't get the fever, don't get anything, and just suddenly throw a blood clot. And so the actual virus makes the blood much behave differently. It makes it clot much faster. So we are seeing increase in heart attacks and in strokes in people, and blood clots. So pulmonary embolism is where you have a blood clot that's maybe in your lung, or in your leg, usually, and it can break off and go. Well, if it ends up in your lungs, that's called a pulmonary embolism. Basically, what that means is an embolism means it's basically a ball that is blocking the ability, blocking the vessel, so that the blood and the oxygen can't get past it. Okay, and so whether it's in the brain, whether it's in the heart, whether it's in the lungs, whether it's in the leg, and so obviously it's way more serious if it's in your lungs or your heart or your brain than it is if it's in your leg. Not to say that your leg's not important, but we like those too. But so just realize that that's why it's not like, oh, just boom, out of the blue, she just had a stroke. So she did, out of the blue, have a stroke, but it's because of this hypercoagulable state. So that's one of the things when you hear about these people. So we've got, what did I say? We've got 5.17 million people in the world that are positive for COVID. We've got 49,000 people, 451 in Florida that are positive for COVID. And not to scare the bejesus out of everybody, but those people are in a hypercoagulable state.
Well, and the crazy thing too is that when I entered the hospital after having the stroke, I would not have been in those numbers either as considered to be a COVID patient, because I had tested negative and there were no antibodies tests revealed as of yet.
Right.
So it was very much like, okay, here we have an unusual case of a stroke patient, until you start unwrapping all the layers. Now, obviously, I'd had many conversations with the team of doctors. They knew. But protocol says, you have to treat each patient differently. Like I was not technically considered a COVID patient at that time. Was not put on a COVID floor. So the numbers are very skewed when it comes out. I am still not counted in that number. And so how many other people are not?
Right.
And that's what I keep trying to talk to people about, is that there's a lot of people out there that are isolating in their homes that haven't even been counted.
Right.
In those numbers as well, but they're smart enough to know I'm having these symptoms, and they haven't been necessarily tested, because why? If you know that you have all these symptoms, you might as well just stay put and not bother anybody with your symptoms. That's what a lot of people think. It is good to get tested just so we do have a little bit more accurate numbers.
Right.
But yeah, and with my blood clot on a brain scan, and it was very obvious. A lot of times you look at these scans and you have no idea what you're looking at. Showing the brain and the two sides, there is a very large brain that comes down on each side that carries all of your blood from the inside the venous sinus system, which it has nothing to do with your sinuses, by the way. When you make that clear, because immediately I went to, oh, well, my allergies, I've been stuffed up or whatever, I have chronic allergies over the years. Nothing to do, they just share the same name. On my right side, you could distinctly see the vein that goes actually down into your jugular and all in there. On this side, it was completely gone. And so that means that that's right where that blood clot stops it, and it needs to find other ways to get that blood out. That's what causes the pressure that I'm having in my head, all kinds of things. And it did go, I had several blood clots, so some there and some that had traveled down into my jugular. And so the hope is that your body naturally dissolves these clots along with the medication that I'm on. And the hope is that I won't have another seizure, that this was directly related to this event.
Right.
But you don't know. And it also is the hope that because I've had the antibodies, I won't ever get it again.
Right. Or at least this strain.
Another unknown.
Right.
It's like the flu,
right.
If you've had it before, you're just going to get a little bit, maybe,
Right.
So yeah, it's a big mystery, all of these things. So yeah.
So it just goes. So I think, 47, not, because you're hearing, so, once again, what I've always been saying, right? You can look at statistics all day long. And when it's you, it doesn't matter about the statistics anymore, right? It doesn't matter. It's you. And so, when you're in that, and she's not even counted in the number. So she's not even, so we really have 49,452 cases.
Right.
Because
let's be honest.
So she's not even part of the statistic, but she is. And so she's so I think that, all these people that are kind of like, I want to get back to my normal. I want to do this. I want to do that. I don't want anybody telling me to wear a mask. I don't want anybody telling me that I can't do, all these things. You're not, as I've said before, you're not just protecting yourself. You're protecting those around you. And we don't know. Yes, we know that the elderly are more at risk. We know that in a small, that oh yeah, she's definitely gonna be on blood thinners. I know that. I don't.
Oh yeah,
There was a question as to whether or not Paula asked whether she would be on blood thinners. Oh yeah, so she still has clot. So I mean, it's not even dissolved. So yes, definitely. And once again, so that's where you do need to, like I said, don't shelter in place. But call the doctor, communicate, and also use your common sense. Use your common sense. And I'm not saying you didn't. I'm saying, I mean, I agree. I think that you can play Monday, morning quarterback all day long. And when you've been to the emergency room several times, your gut response is, I don't want to go back there again. They're going to think I'm neurotic. They're going to think this. They're going to think that. So I don't think you did anything wrong. And they're sitting there telling you don't have COVID. So, so I mean,
the second time, sorry, that you cut out.
Yeah, I think it's just, all I'm saying is that for all those that are listening, this just gives you a little bit of a wake-up call to realize that even though the statistics may say this, and this disease, unfortunately, affects everybody. And just because you're young, just because you're not black or brown, just because you're not poor, or you're not in a nursing home, or whatever else you're hearing as
Yeah.
far as that it can't be you. It can be you. It can be you. And it's not because she's a frontline worker. It's not because she's, she doesn't work for public. She doesn't work for the hospital. I mean, she was
Right.
already practicing her social distancing. She's a teacher. They were already out. I mean, and so
Yeah.
it wasn't, and we don't know why. And that's the bottom line. We don't know everything about this disease. So we don't understand it. So that's what, when we said, they're saying that the surfaces may be okay. We don't know. So do the best you can with what you've got without being petrified. So there has to be, once again, the new norm, and the new norm is going to be wearing your mask. And you should have already been washing your hands, like I said. But if you're not,
That's just
washing
such a
your
weird
hands.
suggestion all along. As teachers, we do that constantly because our classrooms can be gross.
That's
Even
right. That's
teach high
right.
school, I have had to tell kids stop licking the desk. Okay, so we do wash a lot, but that's the whole thing about this, and it is stressful to try and figure out. And obviously, people do need to get back to work, and there is a mental health component. I fear for a lot of the students that I have, like their home is not maybe the best place to be all the time. So in that, when you are going back into reopening and getting back to normal, where some states are not, California is still there like 3 more months,
Well, everybody's open. As far as I know, I think everybody is open to a certain degree.
certain degrees,
A
yeah.
certain degree. But
And at the same time, just continue to take those precautions.
right. Because we
It's
don't want
not
to go
going to
in
hurt you.
quarantine
You'll still be
again.
able to work.
Right.
Yeah, and you'll still be able to work, and you can still go out and you can do your things. But just since they don't know enough right now, and you don't know who you might be passing it to, it could be another person who's healthy and unexpecting of this to happen. I had a moment where I almost would not have been able to ever see my family again. And luckily, my husband and healthcare workers knew what to do and acted quick, and I'm here.
Right.
And you
God
just,
had a
it's
plan, because it could
yeah,
have been, and that's what you think when you start to second guess yourself about, well, should I have gone to the emergency room or something like that. The thing is that you could have been in your room, and
yep,
this would be a
yep,
whole different situation. So
yeah,
God got you out of that room and got you out into that kitchen and brought
yep.
your husband
Oh,
out,
yeah.
and it was it.
There is no doubt in my head. I mean, and I'm not like a very religious person. I'm a spiritual person. I like all religions, all of this kind of thing. But I do firmly believe that there was a reason. There was a reason that this happened. There was a reason it happened to me. That I'm okay to be able to share my story and articulate what I want people to hear. There's a reason my husband woke up that morning.
Right.
All of those things worked out. And the craziest part was during all of it, I told my husband, when I finally was able to kind of like make sense of everything when I was in the hospital, was that I was never afraid,
Huh.
ever. And there was a sense of, you have no reason to be afraid. And I did. I had all kinds of reasons to be afraid. And I never was. I had an overwhelming sense of calm that the doctors noted, that my husband noted, that I was very okay with what had happened. So I think there is a big reason,
Well,
figuring that out still.
yeah, yeah.
But yeah.
Yeah. And I think this is, we can go, obviously that's a whole,
Whole
we
nother
can
thing.
go into, like, what does the whole big,
What's the
thing of all of us, why the world is getting it. And,
Oh yes,
but,
yes.
hey, that's what you have to do is with any situation, right? And I'm sure you tell your students that
Oh yes.
you want to just
Yep.
find the positive in whatever it is.
Absolutely.
And one of the positives is that, when you deal with a near death experience, you value life more, because you really realize what's important. And I think that that's one of the things that, whether, as I've said before, hopefully it doesn't take that for us to, hopefully just this whole experience makes us realize that life is precious, and that we need to love those that are around us, and pay attention to the small things, because that's what really counts. And that you may not get that do-over that we all kind of, because we all think we're immortal, right? I
Oh
always
yeah.
say,
Oh
age
yeah.
is always 20, old age is always 20 years older than you. And I have
Right.
patients who are literally 80 something years old and they'll say, oh, she's old, but they're not, they're
Right.
not old. So now I'm going to let everybody go because it is well after 5. And I really appreciate you
Yep.
hanging in there. And I want to really thank Krista for coming on. And if you guys have other questions, first of all, she's on Facebook, but you can certainly leave me a message on the Why Body Balance Facebook page. Send me a question or on Instagram, and I will certainly make sure that I get the answer back to you because I know my people are kind of bashful, so they tend to ask their questions after the fact. So there's, I think that she will be very willing to answer it. And also,
Oh
that goes for, so Eileen asked whether or not we are recording this. All of the videos are recorded. They should be easily found on the Why Body Balance website. Um, if you go there under videos. So I'll post this one as a post for today. But then if you go down, there's a spot, and I'm not the best Facebook person, but but at least I found that. So there is a video thing, and all of the different videos are on there. But if you have any questions about it, certainly let me know. Yes, she is definitely blessed, and so I really appreciate everybody tuning in. Have a wonderful Memorial Day weekend. Wear your mask.
yes.
If as you go out and about, please do take it serious. Remember that even though we're reopened, that does not mean that you are not that the COVID-19 is gone. Okay, open and COVID-19 are going to be together, not separate. So please stay home. Enjoy your Memorial Day at home, especially if you live in Florida. Most of us have a nice, at least a little plot of land or something that we can call a backyard. So, do some festivities. Nobody's saying you have to stay cooped in the house, but please practice the social distancing. If you're going to be out, wear your mask because it does work, and encourage those around you to wear their mask as well. And get out, get your exercise, enjoy your weekend, and we will see how life in Central Florida and throughout the United States transpires over the next week. And I will see you guys next Friday at 4 o'clock. And like I said, if you like the video, please like us, like the page. And I'm trying to get YouTube together. So give me a minute, but it's Dr. Shelley Knows, and I'm putting like little 15-minute blurbs on there so you don't have to sit there and watch the whole hour if you don't want to. All right. Stay healthy, stay
For
safe,
having
and
me.
stay home. Thank you very much, Krista, for being with us once again. And you have a
Thank,
wonderful holiday, and we wish you good health.
yep. Thank you.
Thank you. Thanks, guys. Take care.